Post-procedure. Now that we've covered the essentials for your surgery day, let's look at what to expect following your procedure. Pain management. Managing pain effectively is crucial for your recovery. We'll guide you through the medications and techniques that will help keep you comfortable.
It is normal and expected that you will have pain or discomfort after surgery. Post-operative pain can last a few days or several weeks, depending upon your individual pain tolerance. To manage your post-operative pain, it is important to take your pain medication on a regular basis, using ice throughout the day, and keep your knee elevated above the level of your heart. Staying ahead of your pain is key. Take your medication consistently at the intervals specified by the surgeon. If medication is ordered every 4 hours, then take it every 4 hours, especially the first few days after surgery. You do not want to let your pain get out of control. If you wait too long to take pain medication and that pain level shoots up, sometimes it takes several dose cycles before the pain level will come back down. It's common for patients to hesitate in taking their prescribed pain medications, either due to how the medication makes them feel or concerns about addiction. Rest assured, if you're using the medication solely for recovery from a total joint replacement, the risk of addiction is minimal. You won't need the medication for an extended period, and your surgeon will prescribe only the necessary amount. Our goal is to ensure you don't experience unnecessary pain. Some patients may find that they can control their pain throughout the day with Tylenol, which is fine. You may want to reserve the stronger pain medications for before physical therapy and bedtime. These are 2 times where the stronger medication is recommended. If you are admitted, they will not automatically bring you medications unless you ask for them. Work with your nurse to keep your pain under control. Communication is key. You will not be bothering the nurse. They want you to be comfortable. You'll be provided with patient education materials, including a listing of potential side effects. Make sure you review this listing beforehand, and if you experience any of these, please notify your surgeon. The more you control your pain, the better off you will be, because you'll feel better, you'll move more, you'll do your exercises, and ultimately, you will recover faster.
Potential complications. Awareness of potential complications is important. Next, we'll go through what to watch for.
With any surgery, there is a potential for complication. We want to educate you regarding potential complications so that you can prevent their occurrence and provide you with the information to recognize a concern. Pneumonia. When you are not mobile and are lying down for long amounts of time, you're not breathing as deeply as you would when you're up and moving about. You're not getting oxygen to the bottom of your lungs. It is this air at the bottom which keeps fluid from seeping into your lungs. Without this, your lungs will start to fill up with fluid. Bacteria will start to grow, and suddenly you'll be trying to recover from pneumonia as well as a joint replacement. Our goal is to keep you moving. You're not going to injure your knee by walking on it. You can put as much weight on it as you can tolerate. Change your position often, at least every 2 hours. Any movement you make with your body is going to cause you to breathe a little deeper. And when you're not moving, there are other things that can help keep air in your lungs so that fluid cannot get in. Cough. Take a deep breath and cough. This will help get air to your lungs as well as clear out any food that has accumulated. You should also utilize the incentive spirometer that was provided to you. It's easier to think of this device as a little deep breathing machine. To use this machine, start by putting the hose in your mouth and inhale very slowly as deeply as you can, like you were drinking a very large milkshake, and hold it for as long as you can. Then exhale. You want the bobble that you'll see rise to go up as far as possible. Repeat this process 10 times once every hour while you're awake. Upon completion, follow with a big cough. This again will help with loosening anything that has accumulated in your lungs. Also, make sure that you are continuing with normal mouth care at least twice daily, as we can all inhale bacteria from our environment. Blood clot. The second complication to be on the lookout for is a blood clot, or DVT, deep vein thrombosis. Blood clots are extremely dangerous and very painful. We take blood clots very seriously. Your blood is constantly circulating throughout your body, supplying oxygen. It is important to keep the blood moving so you do not develop a clot. You can do this by staying mobile and moving around. Remember those exercises we talked about earlier? Ankle pumps, quad, and gluteal sets? You guessed it, you need to be doing these, especially the ankle pumps, to contract your muscles and force the blood to continue moving. All total joint replacement patients are prescribed a blood thinner. It might even just be aspirin. Whatever you're prescribed, make sure that you are taking these as prescribed. Do not miss any doses. These will keep your blood thin enough that the cells will have a harder time sticking together, and you'll be less likely to for a clot. If you are admitted to the hospital, we will put what is called A-boots or a thrombic boots on you. These inflate with air and squeeze your legs repeatedly. When squeezing, they push your blood up your leg just like the function of normal muscle movement. Symptoms of a blood clot in your leg include redness, swelling, heat, and extreme pain. It typically starts in the calf area and will move around to the front of the leg. Should you experience this, you should contact your surgeon immediately. He will order a test and have you come in to determine the appropriate course of action. If you have a blood clot in your chest, you can have shortness of breath, chest pain, or both. If you have these symptoms, call 911. Do not take chances unnecessarily. Infection. Another complication to be on the watch for is infection. Infections are caused by bacteria. The number one way to prevent infection and to fight germs is to wash your hands. This is especially important if you are going to be touching your incision. Also, you do not want to use any creams, lotions, powders, or medicine near your incision. Be sure to check and follow your discharge instructions. Most patients are able to shower the day after leaving the hospital. This means shower only. No bathtubs, hot tubs, swimming pools, lakes, oceans, etc. You do not want to submerge in any body of water until your incision is 100% healed. Germs live in water and have the potential to cause an infection. Additionally, you should also be cognizant of dust and dander, as well as anything which may be on your pet's coat. Keeping the incision covered with your clothing is recommended. Redness, swelling, warmth, or pain near your incision is normal. This is your body's reaction to your tissue being insulted. However, this experience should be minimal. If these symptoms worsen and the pain is intense, you may have an infection. Other things to look for include a temperature over 101, continuous bleeding, foul odor around incision, significant clear drainage or any yellow or green drainage or pus. If any of these occur, you should contact your surgeon right away. You may be directed to urgent care. However, it's best to contact your surgeon first. Constipation. Constipation is a very common complication. It is a side effect of pain medication. It is also caused by dehydration, immobility, and low iron. With that said, the likelihood of becoming constipated is very high for total joint patients. We recommend that patients take both a laxative and a stool softener every day until you're completely off pain medication. The reason we ask you to take both is that they do two different things. The laxative is going to get your gut moving, and the stool softener is going to make the stool softer and easier to pass. If you follow this regime, you should not have a lot of difficulty with constipation. Swelling. Swelling causes pain. This pain can be considerable and lasts for 2 to 3 months after surgery. The way to get rid of swelling is through ice and elevation. It's important to note that these actions won't help if they're not done correctly. You will be provided with a bag of 4 gel packs after your surgery. These will be yours to take home with you when you leave. 2 of these should be used at a time on your leg, with the other 2 in the freezer. These should be rotated every 4 hours. Icing should be applied to the spot where you're feeling the pain. Apply it for 30 minutes and then off for 30 minutes. If you're rotating locations, that is fine. Just remember that each area should be 30 minutes on and 30 minutes off. This should be done periodically throughout the day. If you're only going to do it once in the morning and once at night, you won't realize any benefit. Now let's talk about elevation. You must elevate your leg such that it is higher than your heart. Sitting in a recliner won't do it. You're not going to get the leg high enough. This is important so that gravity can do its job and pull the fluid out of your leg into your abdomen, where it can be reabsorbed quicker. When you do this, the swelling will go down and subsequently your pain level will go down as well. When your pain level goes down, you'll feel better, move and exercise more, and recover faster. It is important to note that you should never place a pillow under the bend of your knee. Because your knee is already swollen, you can cut the circulation to your lower leg off at the knee, and this can result in nerve damage or a blood clot. We need to have blood flowing through that knee and for you to keep your knee as straight as possible when you're at rest. If you want to prop your leg, the correct way is to have one pillow going lengthwise from your buttock under your thigh. Then 2 to 3 pillows horizontal under your ankle and calf. The pillows will help to support your leg and keep it from hyperextending, and there'll be nothing under the knee pushing into it. This also allows for the heel to hang over to facilitate the completion of ankle pumps, which again you should be doing every hour.
Orthopedic equipment. Using orthopedic equipment correctly can aid in your recovery. Let's go through what equipment you'll need.
Let's spend some time talking about other equipment you're going to need or want. The first is a walker. This is the type of walker we want you to have. 2 wheels in the front and no wheels in the back. This configuration allows you to have support at all times while you scoot the walker along the floor while holding onto it. 4 wheels is going to be much more mobile than you'll be ready for. Typically, most patients will get their walker from their orthopedic surgeon's office. If you already have a walker, that is fine, as long as it has the 2-wheel configuration. You do not need to bring the walker with you to the surgery. You'll want to have it in your car to help you get in the house when you arrive home, but there is no need to bring it inside the hospital. After you arrive home, you may want to attach a bag or basket to your walker to provide you with the ability to move items, as you cannot use a walker one-handed. And we don't want you to try. You can also put the patient education handbook in your basket for easy reference if you have any questions or concerns. Every patient starts out on a walker and then progresses to a cane. Many people are not aware that canes need to be fitted to each patient based on their height. To determine the appropriate cane size, you should stand upright with your arms hanging to your side. Place the rubber tip, this is a must-have, end firmly to the ground and lean the cane against your leg and arm. The cane top should stop at wrist level. If it only goes to your hand, it is too short. If it goes to the middle of your forearm, it is too long. It is imperative that whatever cane you choose be the right size and have a rubber tip at the bottom. Be careful. You're not going to injure your joint by walking on it, but a fall could injure the new joint. Insurance doesn't cover the following optional items, but they can be extremely beneficial for you to have: a raised toilet seat. These can be very helpful, especially if your toilet sits on the low side. If you choose to purchase a seat, we recommend that you choose the one with arms attached. These are important to allow you to use your arms to guide you and help you with balance. They will allow you to push down when standing in order to stabilize as well. Safety bars can be particularly beneficial in the bathroom to help prevent falls. These can help with maneuvering in and out of the shower and give you something to help maintain balance. Again, stay away from bars held up by suction cups. Lastly is the shower bench or chair. You can position these such that they are next to the shower, allowing you to sit down and then carefully swing your legs over the bathtub side or shower lip while seated. You can use these for getting in and out of the shower safely. Once you can lift your leg over on your own, it will also allow you to be more independent and shower without assistance.
Urgent care. Unexpected issues can arise. Let's discuss what to do if urgent medical attention becomes necessary.
Before heading to an urgent care, please reach out to the Total Joint Coordinator at St. Elizabeth at 859-301-0405 or contact your surgeon's office for assistance. If it's not truly urgent, we don't want to expose you to the germs in these settings. If you have bleeding, chest pain, shortness of breath, or feel like your mouth is swelling, you should go to the emergency room or contact 911.
Implant cards. Following surgery, you'll also receive an implant card. Let's go through what this is and when it might be beneficial.
A week or so after you are discharged, we will send you an implant card, signifying that you have metal in your leg. It's important to know that these are not accepted at the airport. They can be beneficial at other places like banks, museums, sporting venues, or any place that you may have to go through a metal detector. These laminated cards will have your name on them, the date and location of your implant, and the name of your surgeon. You can stick it in your wallet and you'll have it should you ever need it.
Patient-reported outcomes. St. Elizabeth values your feedback. Here's how you can share your recovery journey and experience with us.
St. Elizabeth Healthcare and your surgeon want to track your recovery over time, as well as evaluate the improvement to your overall quality of life. You'll be asked to complete several online industry standard assessments at various intervals, pre-op, 3 months, 1 year, etc., throughout your recovery process. These take approximately 15 minutes to complete. You'll be contacted by email a few days before the first assessment. and provided with the needed information for participation. If you don't have an email, you will be contacted via phone. The same questions will be asked at each interval, so we can monitor progress over time. Your participation in these surveys is important to our program and will allow us to ensure we are delivering the highest quality knee replacement care to our patients. Note, these surveys are required by the federal government for Medicare patients.
If you have any questions regarding this information or your upcoming procedure, please reach out to the Total Joint Coordinator at 859-301-0405 or send an email with your questions to askortho@stelizabeth.com. Thank you again for choosing St. Elizabeth Healthcare. We are proud and privileged to provide services to you and want you to have the best patient experience possible.